everyone, and welcome to Vivian's series on the Horizon in Healthcare. And my name is Dr. Beth Brooks, and I'm the clinical advisor here at Vivian Health. And today we're going to have a special guest talk to us about nurse staffing. Each month I put out a short video talking about various topics around recruitment and retention and evidence-based strategies. But today we wanted to have a special guest. And so here today to join us is my colleague and new friend, Dr. Sarah Delgado. Hi, Sarah.
Hi, Beth. It's good to see you as
Good to
always.
see you. And I want to just tell everyone a little bit about Sarah. So I'm going to read her bio. Sarah's current role is with the Strategic Advisory Advocacy Department at the American Association of Critical Care Nurses. And she's focusing on addressing the staffing crisis in nursing, advancing a healthy work environments for nurses, and also has influence and contributes to some of the legislation that we're working on for our APRN colleagues. Sarah's clinical experience includes working in chronic disease management and palliative care, and she's previously taught at the University of Virginia and has co-edited books on acute and critical care. So it only makes sense, and I know from Dr. Delgado's credentials, she's also a certified critical care nurse practitioner. Did I get that right?
Acute care nurse practitioner.
Acute care, but a critical care, acute care nurse practitioner. So welcome, Sarah.
Thank you.
It's so good to have you here. So tell us a little bit about your journey. You know, nurses are always so interested in when nurses, kind of move from a bedside position to a leadership position. So talk a little bit about your transition and how you started to work for the Critical Care Nurses Association.
Okay, so I started out as a nurse that worked in general medicine and then moved to critical care and loved that and just sort of wanted to take it to the next level. So I got my master's degree as an acute care nurse practitioner, and I worked as an acute care nurse practitioner in a role that was also a faculty position. And the faculty position gave me the chance to do some other interesting work where I worked with colleagues on a moral distress consultation service, as well as working with chronically ill adults in a clinical practice and teaching nursing students. I then moved to California and worked as a nurse practitioner in a palliative care chronic disease management program. But I was always kind of, and I loved the work I did one-on-one with patients, but I was always kind of curious about how do we address the underlying issues that I see time and time again that affect the care that patients receive in the hospital. So I had the opportunity to move into a position at ACN, at the American Association of Critical Care Nurses, where we provide certification and education for nurses. And also in my role there with strategic advocacy, we look at the health of the work environment, because we know that nursing practice and the effectiveness of nursing care delivery really hinges on the surrounding environment in which they work. We have at ACN 6 standards for a healthy work environment, and one of those standards is appropriate staffing. We conduct periodic research on the health of the work environment, and we know that staffing is consistently the lowest rated of those standards. So we put specific resources into place to address that. And I'll tell you that across my career, I've worked in both healthy work environments and unhealthy work environments. So I sort of have this firsthand perspective of what a difference it makes. Yeah. So that's kind of my story. And then randomly, I decided to go back to school and get a doctorate.
That moment of weakness we've all had, right?
Exactly. I would call it a definite moment of weakness. Definitely an instinctive decision, but one I do not regret. I'm grateful for the journey.
But I've done a prior video, probably 3 or 4 months ago, about the work environment, and I cited some of the data from American Association of Critical Care Nurses and the healthy work environment data. So I know I'm familiar with some of that research that you also do. So one of the things that made you so perfect for the work that you've done on behalf of AACN was your dissertation and your DNP work. And so talk a little bit about, you went back to school, you decided to do a DNP, then what? How did you decide from a nurse acute care nurse practitioner to DNP student, what was your focus? And then what was your project that you worked on?
So thank you for asking about that, Beth, because we always love to talk about our projects. So I'll tell you, I originally planned when I started the DNP program to circle back to looking at moral distress and ethics, which had been an interest of mine across my career. Working in critical care, there are many ethical dilemmas you face in the care of patients. And so I had always been interested in thinking about that and ways to support nurses and nursing students in developing skills to manage the ethical problems they face. What I found when I was in my program, which I began in 2021, when we were still in the midst of the height of the pandemic, the interventions I wanted to test to address moral distress really couldn't be tested because nurses didn't have time to participate in that kind of work. And the issue that was causing the greatest amount of moral distress was a lack of staffing, which impairs nurses' ability to give the care they know is needed. So I switched gears and I conducted a policy analysis of nurse staffing ratios. And essentially my project involved an iterative series of surveys with a diverse group who had very different views on ratio policy. And I gathered from them input on what it would look like if a policy was put in place. So how would this look in the environment you live in, work in, or practice in? And I looked at both the impact on patient length of stay and nurse attrition or turnover, and also asked them about unintended consequences that the policy would have to really try to understand better, because ratio policy is an appealing but very simple solution to our staffing problems. And we know that staffing is a very complex issue. So while a policy may be an appropriate solution, it's probably not the only solution given the complexity of what we face. So I wanted to understand it better.
Yeah, well,
and that's what led to my project.
Well, and I think that's so important because that you say the word ratio and it creates all kinds of, or legislating, having a law that regulates nurse to patient ratios. That is, I think that's probably one of the more controversial things in nursing that we have struggled with for as long as I've been a nurse. That's always been a very contentious issue. So I would imagine to take a look at it like you did and understand it from a variety of perspectives brings a lot of wisdom and insight, because it is such a hot button controversial issue and emotions run high. So it's nice to sort of see it from a little bit more objective and see it from all those different perspectives. So what did you, when you finished your project, like, what did you find? Was there one take home message, or was it, oh, this is complicated stuff?
Well, I think I can summarize it in three take home points. One, I do think the methodology that I use, and it's called a Delphi policy analysis. That's the methodology I use. I do think that methodology is helpful for this topic, because just as you said, when we talk about policy for nurse staffing, or we say the word ratio, it's a trigger for high emotions. And this process of iterative surveys provides a safe virtual space for people to read other people's views and respond. And so I think this process is ideal to studying this topic, because we can sort of be in a safe space together, sharing divergent opinions. So that was one thing that I took from the study. A second thing I took from it is that actually, in spite of having a very diverse sample, the majority felt that a policy of the kind that I proposed would be beneficial to nurses and patients. And I think that means that we really need to think carefully about how to use this kind of policy, or where this kind of policy might be effective, because we're all patients potentially. So if it's beneficial for the stakeholder group that we call patients, it's really beneficial for our society at large. because we are all dependent upon the acute care system to step in and help us when we can't care for ourselves. However, I did find, and this is the third point, that there are many unintended consequences that could result from this kind of policy. Specifically, would staffing go down in places that staff above an established minimum right now? So that's a concern. And would staffing focus so much on numbers that we wouldn't look at patient acuity in the right way? So I think any decision to craft policy has to engage nurses and healthcare leaders together so that we can be sure to create policy that minimizes those unintended consequences.
Yeah.
And those are probably the three main take home.
Yeah.
Well,
and I mean, it makes sense, and it's nice to have it in your work in sort of this objective scientific framework and structure that hopefully maybe can help take some of the emotion out of the conversation. So I want to segue a little bit, but it's very related. So back in, well, I should say, as COVID was starting to lessen its impact on our healthcare system, we were beginning to see the light at the end of the tunnel. There was a lot of news reports, a lot of concern about nurse staffing, lots of worry about nurses who had left the profession, or did they leave their current position? There's all these things in the media. And so there was a group that came together to form a nurse staffing think tank. And so I would wonder, and I know you had a huge role in that. So tell us all a little bit about nurse staffing think tank, who was involved, why was that group convened, and what was some of the work that you all did?
So thanks for asking about that, Beth. So AACN really led the way with a group called the Partners for Nurse Staffing. And that was established in they first started meeting in 2018, but did go on hiatus during COVID because it was comprised of 5 organizations, and we all had to refocus our resources when COVID hit. So the 5 organizations are AACN, the American Nurses Association, the American Organization for Nurse Leaders, the Healthcare Finance Management Association, or HFMA, and the Institute for Healthcare Improvement, or IHI. And those 5 organizations, when we resumed meeting in July of 2021, we decided to launch a task force. And as things were getting worse, and just as you said, as the media was showing us how things were really getting worse, we said, you know what, we can't wait for the task force. We're going to do a think tank. So within a span of 6 weeks, we launched a nurse staffing think tank. And the charge to the think tank was to identify, what can we do right now to make nurse staffing better? So what are strategies we can implement in the next 12 to 18 months to make nurse staffing better? And that work became foundational to later work that was done by a task force. So that group identified that the health of the work environment, addressing the stress injury continuum, increasing and engaging in diversity, equity, and inclusion, addressing compensation, innovating care delivery models, and creating flexible scheduling were key priorities that could be implemented on a shorter time frame to improve staffing. And that document is available online as an open access document.
Right. And then I also, too, Sarah, wasn't there a gap analysis tool as a result of that? So we can put a link to that for folks. So tell us a little bit about the gap analysis tool.
So just last month, we converted the document that the think tank published into a gap analysis tool. That work was done by a team with the American Nurses Association, and it provides organizations with the ability to score where they are with the different priorities and recommendations of the think tank, and really hone in on the actions that are specific to their setting.
And then after the think tank, then what? So then there was a new group. So talk a little bit about the new group and then what that work was, because that was the bigger group, right? That
was a bigger group. So the task force was a bigger group, greater, even more diversity of representation in the task force. We asked, we had finished and published the think tank work. With the task force, the charge was, okay, staffing has been a problem since before the pandemic. What are the long-term sustainable solutions that we can come up with for this, for staffing, which really is a persistent challenge? It reached a crisis point with COVID, but really that was an extension of long-standing issues with staffing. And we know that from our healthy work environment research, that staffing had been a problem before. So the task force met over a 9-month period, every 3 weeks for a 9-month period. So I do have to just call out a huge thanks to the members of the think tank and the members of the task force, because they volunteered their time to this work, and it would not have been possible without their dedication and their expertise. So we met every 3 weeks for 9 months, and the result was published just last month, May of 2023, identifying 5 imperatives and with recommendations and actions to consider. In the think tank, the group really reached a practical consensus of all the recommendations. In the task force, rather than reaching for consensus, we reached for inclusivity. So when folks had ideas for actions, we included them. We didn't necessarily have every member of the task force agree to every individual action. And we labeled the actions in the task force actions to consider, to emphasize that folks using this document should really review all of the actions and consider which ones are best suited to the environment they're in. Mm-hmm. So the think tank has a really strong focus on what organizations need to do with a few policy elements, and the task force has some ideas for organizations and a slightly greater focus on policy and payment structures, because it is the longer standing kind of stuff, like the ongoing challenges and the longer standing solutions.
Right. And so talk a little bit, because I know when I was with you at the AONL meeting in May, I received a copy of the task force report, and there was conversation about what's in the report, what are we going to do with the report. So talk a little bit about because the report's finished, and I know sometimes I feel like we forget to tell our staff nurse colleagues, right? There's associations working on these documents, and there's leadership at the associations, but we sometimes forget there's 4 million of us, right? There's a lot of nurses, and the number of nurses working on these projects is much smaller. So then now, how do we share this information to the other nurses that are out there? And I know you've been, right? You were at NTI, the critical care meeting where all the critical care nurses come together, which are many, many staff nurses. And so talk about the work now of disseminating these recommendations and how it's been received. I'm curious to learn what are the staff feeling about some of this work.
So it's a great question. I think it's a little early to say how people are feeling about it. We have made some progress in disseminating the work through social media and our e-newsletter. And I know that the American Nurses Association has done the same. I know they presented the work at their membership assembly. And as you mentioned, we presented the work at NTI. We think in terms of dissemination, really what we need to do is look at how these recommendations would be implemented. So that's probably going to involve some further content creation. One of the key recommendations, though, in both the think tank and the task force, is that specialty nursing organizations look at establishing or creating staffing standards for the patient populations they serve. And we at ASAN take that recommendation very seriously. So we've already begun on a path to look at what are the appropriate standards for staffing to care for critically ill patients. We assembled a volunteer group, a staffing advisory work group, and we're very fortunate that ASAN leader Vicki Good is helping to lead that work. And she and we're working on releasing something soon about, specific to the critical care population to align with the standards and really to align with the recommendations of the think tank and task force, and to really lean into that recommendation in particular.
To me, that sounds like a really smart approach, right? This is a delicate topic. every nurse will tell you that every patient's situation is different, and that from day to day, a patient's needs and situation changes. And so, and what we might do in obstetrics and new baby, mother baby is very different than what we would do in critical care. So for each nursing association to sort of work on, hey, what are the standards for your particular patient population? That sounds really smart to me, because it's taking out some of that spoken controversy when people say, oh, you can't have the same ratio on this unit as that unit. So to have the nursing associations come together who know the patients the best and know the typical care requirements, it seems like that's a really smart way to take that next step, right? Because we know there's been some publications lately in the literature the last few years, and it's been controversial about some states have staffing legislation, whether that's the right or wrong approach, but there's some states who have chosen to do that type of intervention, if you will. And then there's some talk around we should have legislated ratios at the federal level because of the Medicare dollars that are spent, and Medicare patients deserve a certain level of quality and care. So we have these pieces of legislation and these ideas being floated out there. And until somebody does the work of saying these are the standards, it makes it really difficult to implement any of those things, or even to discuss it in an intelligent way. It seems to me that. So how do you all see that the standards piece sort of, I don't know, marrying up with these requests for staffing ratios? It's kind of, the ratio side is here, but there's a preliminary step, I think is what I'm trying to say, before we take that very controversial step.
Yeah, exactly. That is so well said, Beth. And as you know, professional nursing organizations already serve as standard setting,
right?
In a standard setting role. So for instance, we have the scope and standards for acute and critical care nursing practice, right? So and other nursing organizations similarly establish standards for nursing practice. So it's just sort of an extension of that for specialty nursing organizations to step in and have staffing standards. Whether those standards provide specific ratios or ranges of what is appropriate in terms of numbers, the key is that the standards provide organizations and direct care nurses with an idea of what staffing should be, right? So we're living in an interesting time right now with the increased use of technology to support different kinds of decisions. And so one opportunity is leveraging electronic health record data to look at what is the nursing workload and calculate the number of hours that translates to, and really provide an objective measure of nursing care needs and staffing needs and how to make assignments. And I think that's really exciting technology. I also think it's not accessible to all hospitals right now. So I would hope that the standards that professional nursing organizations, including ACN, what we come up with, can serve as sort of a decision support tool for those who are on the ground making those decisions that are really crucial to patient outcomes. So,
well, and I also think there's something to be said about sitting in a calm, rational, objective environment and creating the standards I was just talking to a startup company this week about the standard of care. That's not related, but their product essentially wanted to change the standard of care. And it was in medicine. Well, that's all well and good, but do you have the right evidence? And do you have data? And do you have a process by which you've come to this conclusion that you want to change a standard based on this new product? And so to have a standard around, this is the standard for staffing for critical care, and then for a nurse to be able to know what's typical and what's not. It's a less emotional conversation because there's been a lot of thought put into it, and you have a standard that's objective, and you don't have to. Sometimes people just well, you should always have 1 to 2, or you should always have 1 to 3. Well, based on what? And so if we had some standards, then we're all talking the same language versus everybody sort of interpreting that different in their mind. Right? I
Exactly.
mean, I think
Yeah.
that's what's important about this work. So my last question is, I'm curious more than anything. Bernie Sanders, who our Senator Sanders, who's an independent from Vermont, he has a very important job right now, right? He's the chair of the Senate, what's called the HELP Committee, Senate Health, Education, Labor, and Pension Committee in Washington, and he had quite a bit of press conference and quite a bit of press coverage back in February and March about his bill that he wants to introduce. I'm looking at my notes. He wants to increase the healthcare budget by $200 billion, and 60 billion of that is to fund the workforce in healthcare. And so I'm just curious, has some of this work caught on with policymakers? Is it still too soon? Are they Washington calling you and saying, hey, Sarah, what did you learn? Because I think that's part of AACN has a presence in Washington, D.C. Part of this advocacy work is about influencing policy. So is it started to have any, I don't want to say impact yet because it's soon, but just any interest in what you all did?
So that's a great question. I think as strong a presence in Washington as ANA or ACN East, the American Association of Colleges of Nurses. They are based in, well, both those organizations are based in Washington, D.C., and we're out here in California. So, however, we do work in partnership with ANA, as I said before, and they just held, just a month after we came out with our task force report, they held their Nurses in Washington Day. And the talking points that those nurses took to their representative included talking points related to staffing and the task force document. So I hope the word is getting out to policymakers about this work that we've done and what they can do to support nurse staffing. I'm excited by Bernie Sanders' proposal because we do have a problem with not having enough nurses, as well as the problem we have with staffing. So we need to create healthy work environments so that we can hold on to the nurses that we have. We need to create systems for staffing that allow nurses to do the work they know is needed to provide care in the way it should be provided. And we need to create processes for preparing a broader workforce and attracting a more diverse workforce into nursing. And I think the funding that Senator Sanders is talking about could be essential to creating faculty positions, expanding clinical site opportunities for nursing students, and really growing the size of our profession to meet the demand for nursing care that we know to be imminent as the baby boomer generation ages.
Yeah, well, so you would think with as old as some of those senators are, I mean, that is a very old legislative body. You would think they'd be very worried about if there were enough nurses when they're going to retire or, are needing healthcare. You would think that would be something they'd pay attention to, but I don't know. So you've done all this great work. What's next? Now, what do you do after all this? What comes next for you?
Well, as you mentioned, we need to get the word out. So we're really, really working on the tools and further content for the staffing think tank and task force work. Again, looking at AACN's role in setting standards. We're hoping to launch some more work on implementation of all 6 of the healthy work environment standards. Our organization is planning to launch that, AACN. So watch for that. And yeah, I don't know. It's weird to have free time after finishing school. So we'll see.
Don't tell your boss that, right? They'll find something for you to do. Well, this has been really interesting. And again, I think sometimes when you're a staff nurse, when you're just working head down, you may not be as aware of some of this work that's going on in support of the staff nurses. And so I think it's really important that they know that there's people out there advocating and working and trying really hard to create better structure and better processes so that we do address the staffing situation and have a more robust and larger, really, nursing workforce. So I hope everyone who watches this is like relieved that, oh my gosh, they're doing something. Because I suppose if you're going to work every day, it can feel like no one's doing anything fast enough, but it takes time to create a better work environment and time to hire nurses. And so to know that this work is out there, I hope makes staff nurses feel a little more listened to, because I think that's also something that comes out a lot, is that nobody's listening, but there are people listening. And both this task force and then the think tank are demonstrations of people are listening. So I think that's really important for staff to know. So I thank you so much, Sarah. This has been so fun. Thank you for
Thank you, Beth.
joining us. And I want to say to our listeners, thank you for coming to our podcast today about nurse staffing. And let us know if you have any questions or comments or need citations or links to some of the different reports and the tools. We will have all that available. And you can find that at hire.vivian.com.